Hello, everybody, and welcome to our event. 3 years of fight for workers' comp is a right. It's so great to see everybody out there. I've definitely seen folks from Brampton and Thunder Bay, Peel, Kinty, Guelph, Barrie, and some others around there, St. Catharines. It's very fantastic to see you all there. So we're going to start our event, as we do many of ours, by having a quick moment of silence for workers who have been injured or killed on the job, and for all of those who may be injured or killed on the job in the future. And we will also think about the fact that while there is a big hill to climb, we're stronger when we're together, and we're stronger when we're focused and organized and fighting for the things that injured workers need the most, and all workers need the most. And we will begin with a moment of silence, and then we will jump right into a slideshow, just a couple of minutes long, 5 minutes long or so, that covers the last 3 years of organizing for Workers' Comp is a Right that was put together by Christine from the Barrie District Injured Worker Group. We'll see you in a moment.
Blindsided by you, blindsided by you. Never saw it coming, oh what a shock. Blindsided by you, blindsided by you. Never saw it coming, oh what an attack. I thought you had a golden heart, never thought you would deceive me. You said you were for everyone, and I thought that meant me. Equality, your motto, your words were all goodwill. Then you sided with the banker man and left me behind. Blindsided by you, blindsided by you. I never saw it coming, oh what a shock. Blindsided by you, blindsided by you. Never saw it coming, oh what an attack. You hired a bulldozer to run me down. You dug up my road and mowed down my home. You ripped down my fence, my security gone. You sided with the banker man and put me in the ground. Blindsided by you, blindsided by you. Never saw it coming, oh what a shock. Blindsided by you, blindsided by you. Never saw it coming, oh what an attack. You broke my heart, you pierced my soul. Your golden heart turned into hollow brass. You sided with the devil, such a vicious attack. But I will not be silenced, now I'm fighting back. Like David
we will rise. We will rise. We will rise. We shall not conform to injustice. We will rise. Above all uncertainty,
We will rise.
through the breaking of a brand new day.
We will rise.
We won't stop
We will
until
rise.
things are right. As brothers and sisters,
We will rise.
united for humanity,
We will rise.
stepping up for the future,
We
rid the
will
world of
rise.
tyranny.
We will rise.
Kicking and screaming,
We will rise.
shout it out in the air.
Through the murk and the storms, we will rise.
We will rise, we will rise.
We will rise.
We must not let greed win.
We will rise.
Compliance no option. We shall not conform to injustice. We will rise. Come help find solutions.
Solutions.
Come help fight the problems.
So many problems.
You are the spark.
The spark.
Together we can make things right. Come march beside us.
Beside
Make
us.
compassion your mission.
Join our mission.
Together we can fight
Fight.
to make things right.
We will rise.
Kicking and screaming,
We will rise.
shout it out in the air.
Through the murk and the storms, we will rise.
We will rise, we will rise.
We will rise.
We must not let greed win.
We will rise.
Compliance no option.
We shall not conform to injustice. We will rise.
We shall not conform to injustice. We will rise.
Thank you so much to Christine for putting that together, and especially also for the music that was provided by the Justice Singers. We heard Blindsided, written by Beryl Brown, and We Will Rise by Heather Sharon von Etzigen. And we are just now, give us just a second, we're going to connect with, hopefully connect with Willie, the acting president of the Ontario Network of Injured Workers Groups. Just give me a moment. Okay. Oh, here he is. Willie.
Hey.
Hey.
Yep.
Okay, let's bring you up. So everybody, this is Willie Noyes, Executive Vice President and Acting President of the Ontario Network of Injured Worker Groups, who's going to give us a bit of a background on where the Workers' Comp is a Right campaign came from and what it's all about.
Okay, well, thank you very much. Thank you all for coming this afternoon. This is a great celebration. It was 10 years ago today that we had a town hall at the Workers' Action Center, and the following day we had a press conference at Queen's Park with Cindy Forrester, who was the former Welland MPP and the critic then for what the NDP had as Labour. Thankfully now, she has the critic that's dedicated just to WSIB and health and safety, and I consider that a victory as part of our campaign. But to get back to the campaign itself, although the campaign kicked off 3 years ago, we had actually started on this probably almost a year before that. There was a group together of lawyers, labor, and us, and everybody was talking about the idea of we needed some kind of a campaign to get injured workers' attention and ultimately to get the government's attention so we could have some positive changes to WSIB. And it was with Aiden that I was working on this. I gave him the idea and just asked, is this something we could pull off? And he thought we could. And so I like to say I was the mother and Aiden was the father. He raised this child. And we knew right from the start that if we wanted this campaign to be successful, it had to be led by injured workers. It had to have their buy-in. So ONIWG as a whole brought all the groups together in March of 17, and they spent the morning trying to figure out what the top 3 demands were, because we knew if we wanted to get the government's attention, it had to be 3 short demands, nothing more, because we would lose them. So we spent the morning, and then I came in the afternoon, because at that point they were down to 15. And by the end of the afternoon, we narrowed it down to the 3 demands, which are end deeming. That has to go, number 1. Second is to stop this idea of reducing injured workers' pay by these so-called pre-existing conditions. And we know some of the stupid ones that we've heard in the past, like some guy who took a baseball to his knee when he was 7 years old, but suddenly that's the reason he has pain today. It wasn't the fall he took at work. No. It had to be some baseball he took to the knee when he was 7 years old. So we can all imagine just how ridiculous these things were. And that's why we have to stop this use of paper doctors or WSIB playing God and reducing benefits. And the third one is they have to start listening to the treating physician. We, as I said before, we've got to get rid of these paper doctors. I don't care what some guy who's never met that injured worker has to say about that injured worker, because 9 times out of 10, it's BS. I know from my own history that my doctor said that I had RSD, and WSIB's paper doctor said it's burning out. That has never happened before in medical science. And yet I've never seen this doctor produce a paper about this magical thing he was able to do. But that's what WSIB used to reduce my benefits. And I only wish I realized back then that I could have fought. And that was my goal from the very beginning, is that my case is over, so let's lead forward. This is a great campaign. It's not only focused injured workers and the entire ONIWG on what we want to do, but it's grown membership, and that's the best thing, because we knew from the start, Aiden and I, that if we wanted workers buy-in, we had to have these demands done, come up with by the injured workers. It couldn't be a top-down, or it would never work. And that was why that morning that they spent trying to go through what the demands they wanted to think of, that's why I stayed out of that meeting altogether. And I remember Aiden saying, well, why are you staying out of this? And I told him, I don't want anybody to ever say this was just a top-down campaign, because that won't work. This was a campaign that we thought of, but it's the injured workers who've built it from the foundation, made it whole. And we've achieved some great things over the last 3 years. You heard many of them in the video that we put out this weekend, or that will be playing at the end of this webcast. So again, I want to thank all the injured workers who've worked so hard on this campaign, because this is one of the best campaigns I've seen in a long time. And once we get these demands met, then we go to the next 3 down the line. And that again will be injured workers coming together to decide what those demands should be. So again, thank you everyone. And one of the big wins that we've had so far is Wayne Gates, the WSIB and health and safety critic for the NDP, has put forward Bill 119 that would end deeming. I'm waiting for a petition from Wayne's office that we can use to gather up signatures and present it to MPPs, because that's what we're focusing on now, is getting people to sign that petition and get it into MPPs, so that MPPs are aware that injured workers are watching, and we want Bill 119 brought for 3rd reading, passed, and then brought for 3rd reading, and then getting the final okay from the Lieutenant Governor, because this bill must become law. We must end deeming. Thank you.
Thank you so much, Willie, for that fantastic summary of all of the things that have brought us here, and of some of the victories that we've won, of which we will we'll hear a little bit more as the day goes on. I'm really excited now to introduce somebody who has been an activist for injured workers and for all workers for a very long time, an activist for labor, but also for those who are outside of labor, for equality for all. And it's my pleasure right now to introduce Patti Coates, the president of the Ontario Federation of Labor.
Thank you very much, David. Hello, everyone. As David said, my name is Patti Coates, and I'm the president of the Ontario Federation of Labor. It's really exciting to be here today to be able to speak to you. And I want to start off by saying congratulations to all of you on the 3rd anniversary of the Workers' Comp is a Right campaign. And as Willie said, although it is the official 3rd anniversary, you have been working on this for quite a while. And putting together an event like this is no easy task under COVID-19. Although we would have loved to have been together face-to-face to discuss and network, unfortunately, under these unprecedented times, we have to do it this way. So I want to congratulate all of the organizers for that. You know, the OFL has a long, proud history of working with injured workers to fight for legislative and policy changes to improve access to workers' compensation in Ontario. And together, we fight for the rights of injured workers. The OFL staff have been key in the development of Ontario's strong network of injured workers and advocates, and we are proud to count the OFL's commitment to the Workers' Comp is a Right campaign as part of that development. The OFL and its affiliates support the demands of Workers' Comp and the Right Comp is a Right campaign. And we made it official Just so that you know, we made it official at the 2017 OFL convention. We couldn't have known it then, but the COVID-19 crisis was about to make the fight for access to workers' compensation important to even more Ontarians. Right now, we have a government that is actively putting workers at risk, has undermined the collective agreements of workers with Bill 195, and refuses to legislate the implementation of the precautionary principle. This is of great concern for workers, as we know that between 2009 and 2015, the WSIB cut workers' benefits by $1.1 billion, and benefit payments have been cut by $800 million each and every year. We must continue to stand together to improve access to workers' comp and tear down the barriers that prevent workers from getting the benefits that they are entitled to. And this is really near and dear to my heart, because I have two family members that are fighting the WSIB right now to ensure that they are protected, and they have been injured at work and they are being denied. So no worker should be killed or injured on the job ever. But sadly, there are still workplace injuries. Workplace injuries affect every part of a worker's life, and we need to make sure that we support each other, because an injury to one is an injury to all. Workers who are injured must have access to workers' comp. Since the onset of the COVID-19 pandemic, the OFL has supported the call for quick access to workers' compensation for workers who contract COVID-19, and called on this government to implement the precautionary principle. And we support the calls of the Workers' Comp is a Right campaign. There must be no more phantom jobs. And the WSIB must listen to the physicians who are treating injured workers instead of using other doctors to make decisions about workers' comp, as Willie talked about. And there must be no cuts based on pre-existing conditions. Folks, we know we are facing down business and government when we say that every injured worker must have access to workers' compensation. We also know that our fight can be won through steadfast solidarity. The OFL Power of Many campaign brings the labor movement together across the province to respond to government cuts, to fight for the rights of workers, and to let this government know that we are the people and we demand change. And we demand change in the workers' compensation system. As we move forward together to make sure every injured worker has quick access to workers' comp, please make sure that you're connected to the Power of Many campaign by signing up at powerofmany.ca. Again, congratulations to you on this 3rd anniversary conference. And remember, we are the people. It is workers coming together that will win the changes that we need. Thank you, everyone, in solidarity.
Wonderful. Thank you so much, Patti, for those wonderful greetings from the OFL and for those inspirational words. We definitely appreciate it. We are now going to move into an exciting sort of new launch part of our celebration. Just as injured workers and ONIWG and allies and activists were coming together to talk about what to do for the 3rd anniversary, the WSIB announced that their president and CEO would be stepping down and that they would begin the process of hiring a new one. The Ontario Network of Injured Workers Groups wrote a letter to the Premier, to the Minister of Labour, to the WSIB, and said this is a service that is for injured workers, and injured workers need to play a role in deciding who will be the next president and CEO of the WSIB. Unfortunately, the letter has yet received no response. And as Willie said, when the Workers' Comp is a Right campaign was started, it was started by bringing together workers from all over the province, from many, many injured worker groups all over the province. And we came up with these demands. Now, obviously, with COVID-19, it's impossible to bring everybody together again. But what we did was reach out to injured workers from all over the province and ask them, if you were in charge of the job description for the WSIB, what would your job description look like? What would be the qualities of that person? What would what would the qualities be of that person? What would their day-to-day tasks be like? And what role would injured workers play in the process of selecting the person who's going to run the WSIB? And so I'm very pleased now to introduce Janet Patterson of the Ontario Network of Injured Worker Groups and the Thunder Bay Injured Worker Groups to present the injured worker written ideal job description for the president of the WSIB. While Janet's speaking, we'll bring up a little link right on your screen if you're watching on Crowdcast that'll take you to a petition that basically presents this job description to the Premier, to the Minister of Labour, and to all of the party leaders and says, look, injured workers need to be involved in this hiring process in one way or another. And one of the ways that you could do that is by using this job description as a guide. So hello, Janet. How are you today?
Yeah, great. Thank you. As you can imagine, injured workers have quite a strong feelings about what we think the president and the CEO of the WSIB should, the qualities that this person is going to need to have a compensation system that truly is going to be there for injured workers. So the president and CEO oversees the running of the province of Ontario's compensation board. The role of the compensation board is, as legislation states, to provide compensation and other benefits to workers and to the survivors of deceased workers, as well as managing finances, facilitating rehabilitation, and return to meaningful work when appropriate. This position requires strong dedication to the community and the principles of justice, and the ideal candidate should be able to demonstrate these capacities through previous employment and voluntary experience in a setting relatable to workers' rights, work injury, disability rights, etc. The organization's new leaders should see injured workers as the primary recipients of the services provided by the WSIB, rather than being customers or stakeholders whose priorities are less important than those of the employers. Day-to-day tasks will include meeting with injured workers and their families, primary healthcare providers, worker representatives, injured worker groups, and others who have first-hand experience of the impact of decisions made by the WSIB in order to learn where the system is failing. Studying compensation systems in the districts around, not only in Canada, but around the world, look at them to find out where the highest injured worker satisfaction rates are, and don't be afraid to institute bold and creative changes to the system that will put injured workers first. Work diligently to reduce stigma within the WSIB by educating employers and the WSIB staff about the damage that is done when disabled workers are treated with suspicion, as if we are criminals. Proactively ensuring employers are compliant with WSIB rules around claim suppression, injury reporting, worker education, workplace signage, etc. And then we have additional qualifications such as a lived experience as an injured worker or a family member of an injured worker or a healthcare provider to an injured worker is an asset. Make sure they really understand what the world is for an injured worker, as well as an understanding of the problems with for-profit insurance industry practices is a must as well. The new president should possess an understanding of holistic medical approaches, understanding that physical, psychological, and emotional illnesses and injuries are interrelated and cannot be placed into silos. Everything is connected. Strong compensation of the comprehension of the history of the injured workers' compensation and a dedication to its founding principles, including compensation as a no-fault, non-adversarial system, compensation as long as the injury lasts, employer-funded, collective liability, and compensation's continuing existence as an independent public agency. Patience, open-heartedness, and honesty are a high priority, as well as a strong desire to have a better compensation experience for injured workers. Immediate priorities are to rewrite the WSIB's COVID-19 policy to include presumptive coverage for workers in vulnerable sectors. Create and oversee a task force that will aggressively look for holes in the compensation system, find workers who are falling through the cracks or who have fallen through the cracks or are facing systemic barriers, and implementing progressive changes to the system to make sure that no workers are left behind. Specifically, work with all levels of the government and civil society to create and institute innovative measures that protect migrant workers from dangerous workplaces and from having to leave the province immediately after an injury. Address the 90% plus job dissatisfaction rate among WSIB employees by ending pressure on frontline staff to reject claims, lightening workload, and developing new training systems less focused on corporate line goals, bottom line goals. We cannot expect them to be in the right frame to be making decisions that are affecting other people's lives if they are suffering, if they're experiencing such a negative workplace. As well, establish a board-funded arm's-length crisis care initiative for injured workers, including a crisis line and improved access to long-term mental health care. For compensation, we feel that the president and CEO will receive the maximum injured worker loss of earnings benefit payment, approximately $60,000 per year based on calculating 85% of WSIB's $95,400 maximum insurable earnings after taxes. Like injured workers, the president will receive a 5% contribution to a private RRSP, and that president will have the option to pay an extra 5% to match it. It will be deducted from their paycheck. The position includes benefits that will cover the costs of any prescription drugs or paramedical treatments such as physiotherapy that is directly related to the job, as long as those expenses are pre-approved by the employer, and dental care is not included. We feel really strongly that they need to understand what injured workers are experiencing, and that will help them to perhaps be more open to creating a better system for injured workers. The hiring process, there will be shortlisted candidates. They will be interviewed by a hiring committee that includes those most affected by their actions, including injured workers, advocates, and healthcare professionals, among others. And finally, we are saying, please sign our petition asking the Government of Ontario to give injured workers an active and meaningful role in the hiring process that is used to choose the WSIB's next president and CEO at www.change.org/WSIB president. Thank you so much.
Thank you, Janet. Thank you for presenting that. And definitely, we also want to say a big thanks to some of the injured workers groups who sent in ideas, including the Injured Workers Action for Justice. The Thunder Bay and District Injured Workers Group had a robust discussion, as they always do, about what could be expected from another president. The Women of Inspiration Group, the Chinese Injured Worker Group, the Bright Lights Injured Workers Group, and others who contributed there. Now, those of you who have been following the injured workers movement for a long time know that there's definitely always a lot of serious work to do, but there is plenty of room for humor. There is plenty of room for satire. And once the idea of having a job description first came around, a lot of pretty hilarious ideas of what the job could involve got circulated amongst the organizers of this event here. And of course, we couldn't just leave those to ourselves. We thought that those deserve some airing out. So we're going to try to get Paul Taylor up here from the Guelph District Injured Workers Group. And he is going to share with us some of the satirical and more humor-related ideas that went around over the last couple of months while we've been putting this event together. How you doing, Paul?
Good. How are you? And hi to everybody out there. Hope you're staying safe and actually, I'd say warm now because the warm weather has slipped away on us, which is okay. I just want to talk about the humor side and why you'd want to do humor. And one thing that I've learned over the years is that if you recall, whenever you watch commercials on TV or anything, probably the ones that are the most memorable are the funny ones, the humorous ones. And I think that's where it can probably drive home your point more effectively when you use a bit of humor. And I think that's where using it in a campaign would be effective. So like, for example, when you're talking about like what Willie was talking about, he explained the 3 demands of deeming pre-existing conditions and pay for doctors. And one idea I came up with in conversations with others was, for example, with pre-existing conditions, if an injured worker had a lower back injury, the board could turn around and say to them that they're denying you because you had sex or something, and because of the sex now your recovery is delayed. It's completely ridiculous, and it's a bit of humor to it. Another one is the paid doctor one, which always comes to my mind as my favorite, is that the WSIB doctors are more like faith healers, where they would slap an injured worker in the forehead and tell them that they're healed, and then take their crutches away from them, and when they fall to the floor, the doctor looks at them and says, "Are you not trying hard enough?" My point to all this is that with a bit of humor, we can get our point across better, and we tried that with the president's job description, which was we tried the things like that the president should only be paid 85% of the actual wages, that they should be at any time deemed whenever the board feels like not paying them, and that if they have any kind of pre-existing conditions, they won't be paid at all. Thanks a lot.
Okay, thank you so much, Paul, for sharing those ideas with us. I'm now going to invite up a longtime friend of Injured Workers, Mr. Orlando Buenastella. Let's just give it a few moments for him to join in here. But we will try to bring Orlando up again later. But the main thing that Orlando was here to do was introduce a very great friend of the injured worker movement, somebody who has been involved for a number of years, who was involved in creating and getting the word out about our Prescription Overruled campaign, the OFL and Ontario Network of Injured Worker Groups campaign that related specifically to the demand about the WSIB listening to injured workers' doctors.
Hello. Hello. How are you doing?
I am doing okay. How about you?
Very good. Very good.
Fantastic. Well, it's so great.
Thank you for inviting us.
Have Orlando introduce you, but I gather you're here to speak a little bit about your experience as a healthcare provider who has to interact with the WSIB.
Yes. Thank you very much for inviting me. I really appreciate it. It's an honor to actually be here today, and it's been quite an experience for me. I started working at WCB when there was a WCB at the time. So we go back literally last millennium. So I have some background on this. I'm a psychologist, so I'm not a medical person. I'm a mental health professional. When my good friend Orlando invited me, I was debating because I was thinking very much along the line of if you have nothing positive to say, don't say anything. So, but I have to say recently, WSIB has made some progress in speeding up the process of accepting mental health referrals. And that's been a great improvement because one of the historical problems was the gap between the accident and the services provided. So that's definitely a great improvement. They have a different program called, it's a community-based program, community mental health program, and definitely that's a wonderful improvement. Speeds up the process, less machinous, less complicated, is more of it's less of a bureaucratic process for us, mental health professional, and definitely gets resolved much quicker. So that's the greatest improvement in WSIB in the last, I would say, year or so. Any questions?
Sorry, Wayne, I'll call you up now. Yeah, I don't think so. Did you? We didn't have a Q&A kind of planned.
Okay, so another thing I think we have to keep in mind, we keep thinking of workers' compensation, but the name has changed literally years ago. It is a workers' insurance. So we used to think in terms of compensation for injured worker. We should have been start thinking about an insurance. So, and the insurance, let's say when you have when your basement is flooded, or when your roof is leaking, you call the insurance. And I don't know what your experience has been, but they never told me, yeah, sure, no problem, the first time I called. So you have to keep that in mind. So there's definitely a philosophical shift that's happened years and years and years ago, literally when we changed the name from compensation to insurance. So, and that's, I think, what people are still thinking of is a compensation system is an insurance system, with all the good things that go with it and all the bad things that go with it. So the process became much more complicated over time. I remember when I started working independently years and years ago, literally all I had to do was just send a piece of paper to WSIB, to the case manager, the family doctor. All he or she had to do was to send a referral letter, say, please assess my client, and that was it. Then it became much, much, much more complicated to the point that people like Orlando and his team literally couldn't cope with the requests, demands, and needs of people that need basically legal and paralegal advice. So, and that's really the main trend, not just in Ontario, but throughout the world, on Anglo-Saxon speaking world, English speaking world, on the compensation idea or philosophy. From my perspective, the most frustrating thing is when the professional that is providing services is not listened to. And that happens so regularly that you don't even, how can I put it? You don't get excited anymore. You don't get surprised anymore. I work with a bunch of younger people, and they come to me and start talking. And you know what they're doing. You know what they're saying. And I'm thinking, yeah, that's what they do. That's what they say. So it's not surprising that the professional, when you provide a diagnosis, an opinion, or recommendation, is ignored. Simple as that.
Thank you so much, Dr. Alekwa. We really
You're
appreciate
welcome.
you joining. And I mean, we will be having further ongoing discussions as a part of a speaker series about each of the different demands, but we certainly appreciate all of the work that you have done to help us get the word out about the way that the WSIB interacts with the treating doctors. It's certainly a side of things that we hear about, but don't get a chance to really know intimately. So thank you so much, Dr. Alekwa, for all the time.
It's a pleasure being here today.
Okay, we'll talk to you again soon.
Sure.
And now we want to bring in somebody, Dr. Alekwa was speaking from the perspective of a health provider and their interactions with the WSIB, but we wanted to bring in now an injured worker who could speak specifically about what it's like as an injured worker, what the consequences are, what the real life consequences are, what it feels like when the WSIB doesn't listen to your doctor. So it's now our pleasure to introduce Wayne Harris.
Thank you, David. Wayne Harris, UA Local 853 Sprinkler Fitters of Ontario for over 30 years. I am on the steering committee of the Ontario Network of Injured Workers Group. Have you ever wondered how to keep people's attention? Well, I hope I do, because I, like you, thought it would never happen to me. I would like to talk about the cost to me and my family due to an injury after a fall off a ladder while I was trying to remove a piece of pipe, in hopes that it will evoke change to a system in dire need. I was first diagnosed with the WSIB doctor as having a sprained shoulder, but the persistent pain told me otherwise. Working with my doctor, I found a surgeon to repair the damage done to my labrum as it was torn from 11 to 6 o'clock. 13 weeks into my recovery of my surgery, my physiotherapist, my surgeon, and kinesiologist said that in 3 to 4 weeks, I could go back to my modified duties. During this time, my company hired an ex-WSIB employee. I received a call from the WSIB, and I was told that in the medical journal, it said that my surgery, I should have been recovered in 12 weeks, and that I must return to work. This is where my real trouble began. I listened to the WSIB and not my doctor. At the time, I was unaware that the opiates I was taking was causing a disconnect from mind to body, and in just 7 short weeks, the surgery I was now ripped apart. When I returned to the surgeon to see how he could help me, I was told that I needed a full shoulder replacement and that I was too young. Due to the excruciating pain running up my neck, with the help of my doctor, I found another surgeon to remove my bicep tendon from my shoulder and put it in my arm. Due to the excruciating pain running up my neck, and put it in my arm, sorry. This alleviated the pain running up my neck, but my labrum is still torn and I need a full shoulder replacement. Working with my doctor once again, we found a surgeon in London willing to do a full shoulder replacement. I just needed to have an aspiration and an MRI so I could determine what was going on. After the aspiration, it was found that I had an infection from one of the first 2 operations. I was hopeful that when I see my surgeon at the end of the month, the infection is gone and we can schedule my 5th operation, a full shoulder replacement. Because I don't want to undergo another operation to remove the infection followed by 6 weeks with a PICC line attached 24/7. The reason I have said all this is because I want you to realize I, just like thousands of other injured workers, have to endure a system that no longer allows us to listen to our doctors and heal in a proper manner. We all pay into this unfunded liability system, the WSIB, with our blood, sweat, and tears. One would hope that in our time of need, this system designed to get us back to work in a safe and timely manner would allow us to listen to our doctors. Unfortunately, new policies and laws continue to blind the WSIB in its commitment to help workers and their families. The cost to injured workers when you take away the ability to listen to their doctors is permanent impairment and chronic debilitating pain for the rest of that worker's life. I'm not sure when it became socially acceptable for compensation boards all across Canada to send workers back to work high on opiates. But after being part of an article in the Globe and Mail on Thursday, June 18th by Kathy Tomlinson, this is standard practice right across Canada. With the WSIB's ability to deem workers, we no longer have duty of care for giving up our right to sue. As I patiently wait in a body I no longer want to be in for an operation I am definitely scared to have, I want to make it clear that the WSIB should not be above the rule of law and take away our constitutional right to listen to our doctors. If we don't listen to our doctors and have and take the medication that's been prescribed, we will never heal. The WSIB should not have the ability to deem us fit and capable of working when our doctors say otherwise. In closing, I would like to say the cost to me and my family is unmeasurable because of the fact that I was unable to listen to my doctor. I no longer live in my beautiful home in Brooklyn. I'm divorced and I have a permanent impairment, living in chronic debilitating pain, which denies me to be a player on my hockey team, to be a coach to my kids' hockey team. I don't fish or throw a ball with my kids or build anything with my bare hands anymore. But I will stand in solidarity with anyone that wants to stand up to the WSI bullies and tell them there needs to be change. We need change. And I am hopeful if we make enough noise about Wayne Gates' Bill 119, it will pass into law and deny the WSIB the ability to overrule what our doctors say. Forward together, we will be loud and proud. Thank you for listening.
Thank you so much, Wayne. I appreciate you, as with every time, sharing your story and sharing your story bravely with everybody and really giving across, that it does have an impact on people's lives when the WSIB makes these decisions that they do. We're just waiting now for our next guest. Just give me a second. Hi, everybody. Sorry about that. I was on mute. I just wanted to tell you about an upcoming event that we have that you've seen on your screen now while we wait for our next guest to come in. And that is an event, we wanted to launch a speaker series that delves into each of the issues a little bit more for each of the issues, each of the demands of workers' comp as a right a little bit more and brings it into the present context. That workers' comp as a right didn't create some of the problems that we're seeing right now, but it has brought some of the most, I'm sorry, that was it. COVID-19 hasn't created the problems that we're seeing right now, but it has brought some of the most ferocious, some of the most damaging, some of the most cruel edges of WSIB policy to the forefront and shown the way that they can play out as damaging as they have. So the second Thursday of every month, we are going to, at 2 p.m., we're going to have a online discussion for now, trying to bring some of these issues that we've always noticed in workers' comp as a right into the current context. And I'm just going to leave this on the screen here for a second while I try to bring up our final guests, and just give me 1 second. Hello.
Hi. Sorry about the technical difficulties there.
No problem. We've got it now.
Okay. All right. Well, thanks for the invite to come. I'll just maybe introduce myself. I'm Jessica Ponting. I work at IAVCO. But today I'm actually here to talk about Justice for Migrant Workers. That's who I'm representing. So Justice for Migrant Workers is a grassroots collective of activists from diverse walks of life. They're primarily racialized organizers. I'm the exception, I think. And we've been organizing with migrant workers in Ontario and BC since about 2003. One thing about Wsib is that we strive for a movement that's led and directed by workers themselves. And also that we're an explicitly anti-racist organization. So we know that racism exists within society and its institutions. And we're critical of the idea that institutions, including the WSIB, are race neutral. We know that it exists and it must be challenged. So I want to talk a little bit about how the WSIB treats injured migrant workers. Hang on, I'm just going to ask David, do you mind just putting me on mute?
Yeah, on the telephone?
Do you, there's just a lot of feedback. Yes, that's so much better. Sorry. So I was just saying I wanted to talk a little bit about how the WSIB treats injured migrant workers. And there's a worker, his name is Robert Solf, and he's agreed to let me share his experiences with you. He is a worker who was a worker on the government's Seasonal Agricultural Workers Program. And the SOP is a labor migration program that exists between Canada and the Caribbean countries and Mexico that allows workers to come from these countries to Canada to work on farms. The thing about the program is that it's quite restrictive in terms of what workers can do. They're only allowed to work with the employer listed on their work permit. They have to live in employer-provided housing, and they're not allowed to come to Canada as permanent residents. You are told basically, you're here to work, and that's it. Shut up and work. So he worked on this program for 24 years. So he would come up to Canada, work on the farm for up to 8 months a year, and then at the end of the season, he would go home, spend time with his family, do some farming work there, and then the following year, he would come back to work on Ontario again. So he'd been making that circular journey for 24 years. About 6 years ago, he got injured. He was working on a tobacco farm just outside of London, and the machine, he was working with a saw, and the blade broke, and it flew up, and it cut his neck. It was a life-threatening injury. It was very close to his carotid artery, and he had to be airlifted to the hospital in London. So he goes to the hospital. He needs to go through emergency surgery and be placed in the ICU. So he's there. When he gets out of the ICU, he returns to the bunkhouse. And that's the place where all workers, all farm SOP workers are required to live. And he's in the bunkhouse trying to recuperate. It's an overcrowded place, obviously, like your family's not there. And he, set to recover, or was trying to recover from this injury. He attends a WSIB specialty clinic, and the doctor there tells him that he's going to recover. He's likely to recover in 12 weeks. And right after that, the employer repatriates him to Jamaica. So what happens when he returns to Jamaica is that the WSIB told him, basically, but for your immigration status, you could have worked in Ontario as a customer service representative. And as a result of this, we are only going to pay you 12 weeks of benefits. So that's how deeming works, and that's how deeming works for migrant workers across the board. No matter the severity of their injury, no matter the fact that they will never be able to come back to Ontario to work, they're told you could work in Ontario as a customer service representative is a very common one, or call center agent. And as a result, your benefits are set to end in 12 weeks. So that happens. Meanwhile, he's not able to access healthcare for his workplace injury in his rural community of Jamaica. So he has to travel to Kingston, which is the capital of Jamaica, in order to get to see the WSIB doctor. So that's hours and hours away, and he's having trouble paying for the transportation that it takes to get to Kingston. And alongside that, he's having to pay upfront for all of his healthcare, all of the specialists he needs to see, all of the physiotherapy, all of the MRIs and the testing that he needs done. He has to pay, as a minimum wage worker, has to pay out of pocket upfront for these healthcare costs. Eventually, he told WSIB that he could not pay for his health care. And in fact, tells them he can't even send his kids to school, he can't put food on his table, can't come back to work on the farm worker program. How do you expect me to pay for my health care? And the WSIB, in their way, said, well, we don't care. If you can't pay for your health care, we can't show ongoing entitlement in your claim, or we can't show that you have an ongoing injury. And so we're closing your file. And so that's what he told them. So what happened is he fought back. Much like many of the people who are part of this call, he didn't have a choice, and he fought back. He participated in Injured Workers Days from abroad. He did things like provided statements for allies to read at Injured Workers Days and other actions. He talked with media and was willing to be open with them about what happened to him. He organized with other injured migrant workers to file a claim at the Human Rights Tribunal. And this group of injured migrant workers got together and talked about what changes they themselves wanted to see. So these changes were things like the WSIB needs to investigate whether healthcare is actually available in the home country. They need to have a plan before they send injured migrant workers back home. They need to give workers a choice of whether to stay in Ontario for healthcare. And if workers decide to go home and be with their families, which is totally reasonable, that the WSIB needs to pay upfront for medical care and needs to pay for doctors and tests like MRIs directly to the healthcare providers. And needs to fund transportation expenses upfront. So this is what this group of injured migrant workers decided, and they filed this claim. The group also connected with Injured Workers Action for Justice, who is another, of course, injured workers group in Ontario and in Toronto, and worked together to put on an action at the Human Rights Tribunal to deliver the claim. And I think together with this group and with Injured Workers Action for Justice, they fought for access to healthcare for him and for other migrant workers like him. And it worked to a certain extent. It's by no means perfect right now, but the WSIB is paying upfront, or is committed to paying upfront for injured workers transportation, and they're now contacting doctors directly. There is a lot of work to be done. There are still significant problems with workers being able to access healthcare, but it was through that organizing work that they were able to get some of these changes. So what I'm hoping that folks might take away from this story, is a couple of things. Sort of first, racism exists here. It's involved in the structure of the SOP, the structure of the farm worker program, which forces racialized workers from the global south to accept conditions that would not be tolerable to Canadians or permanent residents. The conditions like, being required to live on your employer's premises, being unable to change employers, being not allowed to migrate here permanently. This heightened disposability wouldn't be acceptable for Canadians and permanent residents, but it is acceptable for this group of racialized Black bodies and brown bodies from the global south. So I think that's a problem. And I think also we need to acknowledge the racism that is involved at the WSIB. WSIB tells migrant workers that their losses are not as important or meaningful. It is totally fine with their injuries being invisible. And that, in this case, means workers are literally repatriated and disposed of without access to even healthcare or workers' compensation, which, of course, I think everybody here recognizes is an issue is a systemic problem across the board. But this is happening. The heightened effect for migrant workers, just not even being able to access like an MRI, is so strong. And I think it also talks about the importance of having inclusive movements and making sure everybody is visible and everybody has a voice and everybody's, meaningfully engaged in organizing and promoting sort of that self-directed or that where workers are organizing themselves, but it's in an inclusive way. I think it also talks about how injured migrant workers are fighting for the rights of injured workers and against the WSIB from across the world. And I find a lot of hope in that. Just personally, as somebody who kind of deals with the WSIB on a day-to-day basis and sees what harm that they cause injured workers, it's exciting for me to think that there's so much resistance from injured workers from across the world. And I think it's important as well to recognize worker organizing in campaigns like Workers' Comp is a Right, because I think this is what justice is about. It's about recognizing that workers organizing is the only way things are going to change. And it's incredibly hopeful, as I said, to see all this organizing happen. And I wanted to thank also all of the workers here who are involved in that organizing, because you're all just such inspiring activists to me. So just leave it at that. Thank you.
This month marks the 3rd anniversary of the Ontario Network of Injured Workers group Workers' Comp is a Right campaign. Injured workers from across the province built this historic campaign to focus our advocacy and to inform politicians, the public, and the WSIB of our demands.
By now, many of the actors we've been trying to reach are aware of our 3 demands.
End deeming by stopping the practice of pretending injured workers have jobs when they don't.
Stop cutting injured workers' benefits based on so-called pre-existing conditions that never bothered us before our injuries.
And number 3, listen to our family doctors by ending the use of paper doctors.
As we celebrate the 3rd anniversary of the launch of our campaign, we have witnessed some positive changes.
For one, we have won important battles relating to the way the WSIB treats pre-existing conditions when calculating settlements for permanent injuries.
This important legal victory achieves part of our one demand.
We still have to stop the practice of reducing our loss of earnings benefits based on these pre-existing conditions.
Together with our many allies, we have raised the profile of injured workers' issues to the highest level in decades,
leading to hundreds of stories in the media and much greater community knowledge.
Prior to the last election, we hosted an election debate. In the last provincial election, for the first time in recent memory, 2 of the parties included injured workers' issues in their platforms. We continue to work with all parties to ensure these issues will become a standard part of their election platforms moving forward.
In addition, 2 private members' bills now sit before the Ontario Legislature, introduced by the NDP's WSIB and Health and Safety critic Wayne Gates.
The fact the official opposition has a critic dedicated to workers' comp issues is a victory in itself.
One of his private members' bills, Bill 119, would end deeming.
We look forward to continuing to work with MPP Gates to see his bills called to a vote and passed into law. Last year, we raised the issue of deeming to the international stage by bringing forth a complaint to the United Nations,
focusing on the violation of human rights of injured workers with permanent impairments.
This current COVID-19 has underscored how important changes to the WSIB are. This coronavirus is causing a whole new kind of work-acquired illness.
To date, the WSIB has denied over 1,000 workplace-related COVID claims, including 600 that have been filed by workers in the healthcare sector.
While the federal and provincial governments provide improvements to nearly every other social benefits system to provide additional funds to offset the increased costs of living in a pandemic, the WSIB stands alone in refusing to help cover these costs.
In fact, they continue to pretend that thousands and thousands of injured workers have jobs that do not exist, allowing them to continue to cut much needed benefits.
And even with economic conditions and job losses on par with the Great Depression of the 1920s, WSIB continues to tell injured workers they should be out there working in dangerous jobs that simply don't exist.
We have always said that anyone is one slip and fall away from becoming an injured worker. Now, with COVID-19, you may be one breath away from a possibly fatal work-acquired illness. Workers need to know that the workers' compensation system will be there for them when they get sick and injured.
The system we have now is not adequate. That is why we have fought so hard and will continue to fight even when it seems the deck is stacked against us.
We ask our allies and the general public to continue to work with us. You can join in our fight in several important ways. Continue to send letters to Premier Doug Ford and Labour Minister Monty McNaughton, asking them to support the priorities we developed 3 years ago.
Or sign a petition in support of our demands. And join our mailing list to stay in the loop by visiting tinyurl.com/workerscomplist.
Injured workers have reason to celebrate the achievements of the last 3 years. Many of us didn't get all we needed from the WSIB,
but we fight on for our sons and daughters and for our grandchildren and their kids. Workers' comp must be a right.
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 Because workers' comp is not a privilege, workers' comp must be a right. Thank you.
Okay. I just want to come on now and thank everyone today for all their efforts today. I want to start with thanking Catherine, Wayne, Paul, and Janet for breathing life into that text about our struggles and our victories over the last 3 years. It was a great video, and we also owe thanks to David for not only editing that video, but for also putting this together today. So thank you very much, David. And I want to thank our speakers today. First, I want to thank Jessica for bringing that injured migrant workers story to us today. We needed to hear that. It's a reminder again of the fact that racism still exists in Ontario and that it's alive and well at the WSIB. And among the many changes we need to make at WSIB, that has to be one of the first, along with ending deeming. You cannot discriminate against somebody based on their skin color. That is absolutely reprehensible. And the Ontario Network of Injured Workers Groups stands with those who are fighting against racism. Again, and I want to thank Wayne for sharing his story today. That was so honest. And it's truly heartbreaking that he had to go through that. But it's a reminder again of why we need to continue this strong fight, this great campaign to make workers' comp a right. Because there are too many injured workers like Paul, like Catherine, like Janet, like all of us who have been hurt by WSIB. And that can't be allowed to continue. That's why we're fighting. I want to thank the doctor, and I can't remember his last name, who not only shared with us the challenges he faces as a physician, but also the challenges that injured workers face when they're dealing with the WSIB and their medical. It's a reminder again that we got to get rid of paper doctors and start listening to the injured workers treating physicians. And I want to thank Janet for going through the job description that the various groups have come up with. I can't think of better job descriptions that are in there, because that's what we ultimately need, is somebody who's empathetic with injured workers' concerns, their challenges, etc. We need somebody like that as the CEO of WSIB. I'm tired of these political appointees who are only there because the premier of the day decided they wanted them in charge. It has to be somebody who's not only hired with the consent of injured workers, but who has the back of injured workers. WSIB was supposed to be about workers' compensation for injured workers, not this BS about an insurance industry. That's the last thing we need. I want to thank Patti Coates for being here with us again as the president of the OFL. The OFL's been with us from day one on this campaign, and we thank them for always being there to pass resolutions and to speak out with us for the need for a better workers' compensation system. And I want to thank Heather and Beryl for sharing their songs with us. That's the kind of talent that injured workers bring to the table. And lastly, I must thank Aiden Mcdonald, who has gone on to other work. But without Aiden, this campaign would never have gotten off the ground for injured workers to breathe life into it. As I keep saying, I was only the mother. Aiden was the father. He raised it, and the injured workers have breathed life into this. And together we will continue to move on. And I can't wait till someday we're here celebrating the 10th anniversary where we have new demands and our challenges have been met. Thank you, everyone, again for attending today, and give yourselves all a pat in the back for all the work you've done to raise awareness of the fact that workers' comp must be a right. Thank you, everyone.